Now we're gonna do our dressing change. First, we start with moving all of the ECG wires out of the way of the dressing field, including our pacemaker wires. Then we're going to begin with our chest tube dressing. Starting at one end, gently pull it off, making sure not to pull anything vital. Now we're gonna remove the dirty gauze and the chest tube drain site gauze. Next, we're gonna go to the sternal incision, and we're gonna start at the top and pull down, holding the skin on either side. Next, we assess the sites for any signs and symptoms of infection. Then we remove our dirty gloves, use Purell, and place a pair of clean gloves on. Now we take our ChloraPrep and we begin from the top and we go down the sternal incision. And then we do one side and the other side, making sure to get it nice and wet. And then we begin with our chest tubes. And we go around and really clean those up. Next, we go to our pacing wires and we clean those sites as well. Then we let it air dry. Once it is air dry, we can start to dress. We take our 3x8 Telfa dressing, and we place it right over the sternal incision. Then we take our skin-friendly blue tape, and we don't need a lot, just enough to cover the sides. We kind of measure it. Then we take our clean drain gauze pads and we tuck them under our chest tubes. And it's okay if they overlap. Next, we're gonna get our 4x4 gauze and just cover it for protection. Then we're gonna take our abdominal pad and we're going to coil our pacer wires so they're secure as well, and cover them with the pad. Make sure that they come out from the top so as the tape doesn't get stuck on them. Next, we're going to take our silk tape and we use this tape as it's a little more durable for the weight of the pacer wires. Lastly, you need to date and initial your dressing, making sure it's written on the tape and not any gauze. And there you go.